Hello and welcome to the Black Dad Brand Podcast. I'm your host, Jamil Pugh, and today we have a special guest. We have certified nurse, midwife Tia Thompson, who's going to talk to us about reproductive health and some of the things that you really need to be paying attention to as you're supporting your partner through their pregnancy and into the delivery room. And so before we get started, I just want to take a quick second and allow Tia to quickly introduce herself and tell us a little bit about her career as a certified nurse midwife.
Okay, thank you, Jamil. I'm glad to be here. This is a very important topic, and so I'm more than happy to participate and try to give some information, education as much as I can. So my name is Tia Thompson, and I actually have been a midwife for about 6 years, and I work in the hospital setting here in Sacramento, and I actually provide prenatal and postpartum care, as well as reproductive health and support from teenagers all the way into adulthood. Um, and I chose to go this path specifically because I want to target women of color and provide midwifery care across the landscape of hospital care because a lot of our moms tend to have their babies there. So it's been a passion of mine. I've personally had children of my own with midwives, so I always support midwifery care, whether it's in home, birth center, or hospital as well. So I'm happy to be here and answer your questions.
Thank you. Thank you. So, for those fathers that are out there who, just got the news that they're pregnant and expecting a new child, um, what are some of the things that, you know, they should expect throughout the 3 trimesters that kind of indicate that you're having a healthy pregnancy and things are going along pretty well?
Okay, I think that's a great question because I always like to start with, well, I think it's important to get people to start thinking about planning for becoming pregnant as much as possible because there's things that we can do before you even decide to get pregnant to get your body healthy as much as possible. And a lot of times that starts with nutrition, movement, and exercise, right? Trying to get our bodies healthy so that we can carry and grow this very important vessel. Um, so that's usually what we need to start with. And so changing and looking at how and what we're eating and trying to make a small adjustments as well is really important. So eating as close to the earth as possible. Fruits, vegetables, lots of good sources of protein and healthy grains are really at the cusp of it. So really trying to stay away from like fast food, high cholesterol, high salt type foods is really important too. And then exercise. I think a lot of times people get discouraged with exercising because it feels like regimented, but I always tell my moms to make sure that you're just doing movement that feels fun for you so that it doesn't feel like exercise. So whether that's yoga, swimming, dancing, tennis, I mean, there's a lot of things we can do to just keep ourselves active. And that's the most important thing because that's how we balance having healthy weight gain and keeping balance in life too, and emotional health too. So I think that's probably the beginning of it for that's the most important piece. And you kind of carry that on throughout the entire pregnancy because you need to have balance with your weight gain so that you can grow a healthy sized baby as well. And that also can help ward off things like diabetes, high blood pressure, some of the many things that plague our community specifically in pregnancy too.
So you talked about, the dietary restrictions or things that you should eat. I know that, sometimes people will say you're eating for two, and I've heard that that isn't necessarily how you should think about it, but
Right.
what would be the proper way of thinking about the nutrition that you're providing yourself and the vessel that you're carrying?
That's actually a really good point because I think in our community, especially, that's what you typically hear is you're eating for two. And I think it's more important to make sure that you're eating. Some people can do 3 meals a day and then they're fine, but a lot of people just need to graze throughout their day. And that I think, and of course, like I said, eating high sources of protein in your food is really important because that helps you to feel fuller for longer. And so you'll be less likely to want to snack on a lot of junk foods and salty foods and sweet foods, right? Because in pregnancy, the reality is when we have cravings. And so it's hard to curb that. So I think it's just
Mhm.
doing things in moderation so that you're not trying to be overstuffed, but it's really just I'm eating to nourish and grow my baby. Because at the end of the day, the baby is going to get all the nutrients they need from you, no matter what. And so you want to make sure that you're replenishing for yourself and for your stores. I think that's the most important piece too.
I want to ask another question. We had spoken before about preeclampsia
Hmm.
and um, and gestational diabetes. Is there any correlations that are scientifically proven enough to say that diet, whether there's sugar or salty foods, does increase or impact a woman's chances of getting preeclampsia or preterm diabetes?
I mean, I think that we definitely can't count out like what we eat in terms of if we're more susceptible to having the like diabetes in pregnancy or preeclampsia or any type of hypertension. But specifically with preeclampsia, research really hasn't been able to hone in on what specifically causes preeclampsia in everybody, but we do know there are certain risk factors that can make somebody more susceptible to developing it. And there's a huge range of things. If you have a history or family history of hypertension or like preeclampsia specifically, your BMI, um, gosh, there's so many things.
And that's body mass index,
Yes,
right?
I'm sorry. Yes, body mass index.
Okay.
So,
Yeah.
the balance between your weight and everything. So that's really important. We found that racism also, specifically plaguing the Black community. We are more high risk for having preeclampsia. And so I don't think there's enough research to show why it can happen more in certain people, but we know that if you have one or two of those specific risks, it can increase your risk of developing preeclampsia in the third trimester specifically. And with gestational diabetes, it's kind of the same thing. Like if you have a family history of diabetes, it makes you more high risk for gestational diabetes. Or if you've had a previous pregnancy with gestational diabetes, you're higher risk as well. So we really try to enforce balancing what you're eating and your exercise because that can sometimes help offset developing it, but sometimes people get it in one pregnancy and never have it in another. So it can be random in some instances, but having gestational diabetes can increase your risk of developing type 2 diabetes later on outside of pregnancy. I think about 50% greater. So it's important to try and prevent it if we can.
So, with that being said, what are some of the essential perinatal tests and screenings that should be done throughout the pregnancy?
Throughout the pregnancy. I think I would say typically for me, like in the beginning of the pregnancy, I try to do just depending on your history, because it's important to find out what your health history is and your family history is, because that will tell me how can that maybe impact your pregnancy experience. And so baseline things that we look at is like, are you anemic? So do you have low iron stores or a low iron count in your blood? Because that's important for oxygenation, getting that to the rest of your organs of your body. Um, it can affect
Okay.
how like you feel physically in terms of like so a lot of people are really tired, don't have a lot of energy, they're cold, things like that. So anemia is pretty important. Knowing your blood type is important. We do typically look at if you're a risk for, like we talked about, diabetes or high blood pressure. I might do labs that will kind of screen for that just to see what your baseline is so that if things shift and
Right.
change during the pregnancy, I have kind of a baseline to compare it to. Is this a change? Is this a significant change that I should be concerned about? Um, Other things that we pay attention to would be monitoring your blood pressure, obviously, is super important. Um, Trying to think what other thing the third trimester. We do screen for other types, sometimes risk for certain infections that could present later in the pregnancy as well, too. So gut health also important.
So, and we're talking to you as a midwife, and you're kind of giving that advice from that perspective.
Mhm.
But can you kind of give us a broader understanding of what the role of a midwife is during pregnancy and delivery?
Yes, definitely. I think, well, the scope it can vary based on what type of midwife licensing I have, but at the end of the day, we all are midwives and we practice midwifery at the core. And I think that usually focuses on providing education information, informed consent to help you make decisions collectively together that will meet kind of your vision for your pregnancy and your labor and and your birth experience. And so we really try to center the person and all of the social things that might impact you can affect how you experience those things too. And so I think from a midwife's perspective, we are typically much less medicalized, although I can take care of people from a medical, I guess, more medical scope if I'm dealing with more high risk stuff. But, at the foundation, we deal with normal, healthy pregnancy, and we really try to support that through all of the things that we've talked about so far.
So, as a father's going through this process, and in what ways might he be supportive of his partner going through the pregnancy and even into the delivery?
I think there's a lot of ways that fathers can be supportive. One of them, I think, is just really acknowledging that your presence is needed. And that can look
Mm.
that can look a lot of ways. That can just be simply, supporting them. So let's say if you do have a mama that is struggling with like diabetes or something, that can be a huge adjustment for people because you're making a huge shift that maybe you're not used to on a daily basis. So trying to change your eating habits, all of that can be really hard. So I always tell people to do it collectively as a family rather than saying, you shouldn't be eating that. It's like really make the change for the family because at the end of the day, it's going to be beneficial for everybody. So I think doing things more together as a unit can be helpful. Being encouraging to them, um, lightening the load wherever you can. So if you have other children, you can be kind of helping with the responsibility of that, making sure that they have healthy meals to eat. So that could be you cooking as well, making sure that they can have better balance because it is hard to juggle being pregnant, taking care of yourself, taking care of your family, things like that. So I think really is trying to be informed yourself about what's important and what impacts their pregnancy and how you can help support that. And the same thing can be said in the labor and birth experience too. I think that's probably where you see that fathers are really needed the most because labor is like a very very sacred spiritual space and energy to it. And so you want to come in respecting that. And so I always tell people to have people present there that are going to help support you through your labor experience. So it's not helpful to come in and, maybe be watching TV or like doing things that are distractive and not really focusing on the birthing person because they need that energy, they need that support because it is hard to get through labor physically. So having people that support
Right.
you through physical comforts, encouragement, advocating for you when you can't really speak for yourself because you're just trying to get through each contraction. That's how you can be present and show up for your partner, and know that your place is valuable and that you're needed too.
Specifically talking about like the perinatal visits where moms coming in for different checkups,
Hmm.
and I remember through my two children, some of the visits are a little bit longer. I think the first one's really long, and then the
Hmm.
rest of them are sometimes really really quick. And so is there any other ways in which it's important for the father to be there for those visits? Anything that they should be paying attention to?
Hmm.
I know for me, the biggest perinatal visit was just finding out the gender, and at that
Hmm.
point, I felt like, all right, I'm good. But
Yes.
how else could the father be, supportive or helpful during the visits?
I think really, like you said, number one, showing up, whether it's a 15-minute visit or an hour-long visit, right? Um, and collectively, you can come together before your appointments and come up with a list of questions. Because I always appreciate when families come with questions because it's telling me that you're number one invested in what is best for you, and you want to be educated as well. And so coming together, I think, with questions is really important, whether it's your own questions or, together with your partner. That is important. And then the other things that I think about would be if there are specific tests that maybe we're doing or recommending or, vaccines that we're recommending, you want to inquire about those. You want to read about it, study about it, so that you can be informed about, do you want this for yourself or not? Because everything really in your pregnancy is a choice. Same thing with your labor. It's a choice, a decision you guys should make. It's not something I'm saying you have to do this. These are just my recommendations. But if you don't know and understand the reasons why we recommend it, then how can you make an informed decision? So I think those are really, really important too.
You kind of alluded to this earlier in terms of like being supportive, helping to make some of those lifestyle changes when it comes to like maybe,
Hmm.
maybe it's not just the mother who's changing their diet. Maybe, you both can stop
Hmm.
with alcohol or fish or anything like that. But and then maybe you both can exercise together or take walks or things of
Hmm.
that nature. But are there any other lifestyle changes or precautions that the family should consider doing during this time of pregnancy and going into labor?
Well, I mean, I think when you think about in the home, there are things that you certainly want to start thinking about in terms of like safety, for a new baby that's coming into the home. So little things like really, I always tell people get down low to the ground when you're trying to figure out how to make your home safe for your babies. Just get down low to the ground because you're getting at their eye level. And so thinking about things like electrical sockets, cabinet drawers, things like this are things that you want to do to help make it safe. So that's one thing that's really important. Um, Other things that are important for pregnancy. Um, I think you really probably hit more on it when you said about how just doing things together is really important. And so a lot of times fathers will kind of have emotional eating too, during pregnancy
Hmm.
because your partner's eating, I'm for it, baby, I'm eating too. So a lot of times partners start gaining weight too. And so that's why I encourage like you
Yeah.
said, exercising together. And then it doesn't feel so strenuous. It feels more like fun. And you're also creating time to bond with each other because that's a huge shift once you have a baby is how to make time for yourself individually and also for your partner. And so I think these are things that you can incorporate in pregnancy, but also move it into postpartum and continue those same patterns so that you can maintain a healthy balance for your relationship too, because that's very important as well.
I was talking to a good friend of mine, and he was talking about like, making sure that the environment during pregnancy is as stress free or stress less as possible,
Hmm.
so that you're not putting extra anxiety on your partner, or you're not worrying excessively, or they're just not overcome with stress, because I would assume that that could impact preterm labor, or it can also impact other health concerns for that person. So maybe considering a way to deal with conflict,
Hmm.
if you haven't already established a strong way of dealing with conflict and communicating and thinking through things, so that you're more proactive when it comes to supporting her needs, and or the other children in the home, or whoever else is in the home, making sure that the environment stays as stress free and relaxed as possible.
Hmm.
How might that be another way to support the birthing person?
Yeah, I definitely think that's important. I think it's important to listen to each other, and really communication is super important. Talking to each other about what you may need and how those needs may change throughout the pregnancy, as well as maybe things change in terms of your health or something like that. So I think communication is very important as well because when we are less stressed, right, especially if you're pregnant, you do have less impact on risk for like preterm labor or low birth weight, which is pretty important and something that we see very commonly in the Black community. And so I think making sure that you are being present for your partner is important, and understanding that, growing a baby is it's not easy. Like there's a mental, emotional shift that happens throughout the entire pregnancy. And so I think the needs that people have also change. And so if you're able to talk to your partner about that, and also about what you as the dad also needs too, because I think sometimes dads feel left out um, many
Mhm.
times. And so I think, again, I think for Black men, I encourage them to be more vocal and like emotional and like vulnerable. That's what I mean. More vulnerable with your feelings too. And communicating that to your partner.
So I want to talk about childbirth, and labor.
Hmm.
There's, to my knowledge, three options for childbirth. There's in home,
Hmm.
in hospital, and I believe birthing center is another option.
Yes.
Would you mind kind of explaining those three, and if there's another option that I didn't cover, just so that the families understand, like, these are my options to deliver this baby?
Hmm. I mean, I think it's great that we have options because I feel like there's a place that feels comfortable and safe for each person, right? And those choices, I think a lot of times are based on people's desires and what they want, I guess what they envision for their experience, but also there's a financial component too. The reality is that a lot of people can't afford to do out of hospital birth because most times you have to pay out of pocket. And so I think having access to midwifery care in all three of those settings is extremely important to maintain as much as possible. So having your baby at home typically is what was done for centuries before hospitals were kind of
Hmm.
created and medicalization kind of took over the forefront. Most people had their babies at home. And so I think before my grandmother's generation before typically had babies at home. And they were always with midwives. So usually with a home birth midwife, typically you're going to get a different experience in terms of your prenatal care. You're going to have somebody that's going to be able to sit and have your visits are usually 30 minutes to an hour long, but it's not just focusing on let me just check the baby and your vitals. It really is assessing your nutrition, talking to you about exercise, talking about what's going on in your home or in your life, the stressors that we talked about. So really addressing the full person. And typically these are people that are normal, healthy people with very low risk pregnancies that have their babies at home. Um, and so typically it's in your home wherever you desire to have that. And there's beauty in that. I had my last three at home personally and love it. I wouldn't personally have done it differently if I could, if I was to have another baby. But it's not for everybody, right? It's not for everybody. So that's kind of what it typically looks like. And it's usually really nice because you have the midwife that comes to your home when it's time to have your baby. It's a very relaxing space that's comfortable for you. And so typically your labor progresses better, or easier, I should say. And also postpartum, you have a little bit more consistent care. So it's not just I have a 6 week postpartum appointment. You usually have like, within a week, you have maybe one or two visits, and then they kind of spread them out between the 6 weeks, which is important because postpartum is one of the most important periods after having a baby. That's where you see a lot of challenges for parents. So that's
Hmm.
the home birth situation. The birth center is kind of a nice balance between the two, between home birth and hospital. Usually in a birth center, it is a facility that you are going to get your prenatal care, and then when it's time you have your baby, you go there. You're physically going there. A lot of times it kind of looks, they design most of the birth centers to look like a home, if you will. So the rooms are really like a bedroom kind of feeling. So a lot of times they'll have like
Hmm.
tubs if you want to do water birth. You have access to like IV um, needs and things like that. So it's just kind of nice. I think people like that because it's a place where if you don't want your home to be like the central place, you have this other type of home like setting, but you get to go there, have your baby, and you come home within like 12 hours, usually, something like that, depending how you and the baby are doing. And then the hospital, obviously, you come in, you have your baby. You usually get your prenatal care there, but like you mentioned before, typically your visits are very quick for your prenatal care. I mean, usually 15-minute appointments, if and that really turns into about 5 minutes by the time I get to see somebody.
Hmm.
Um, so for me, it's great because I can provide midwifery care, but there are challenges because I feel like with the time constraints, I'm not always feeling like I'm able to really practice midwifery care the way that I would like to. But I do see that um, a lot of the people that I care for, they feel the impact and they feel the positive impact. And so that's just a reminder to me that my role is just as important in the hospital as it would be like out of the hospital. And typically I see people that have more high risk type pregnancies. So people more with diabetes and high blood pressure, some other things that cholestasis, things like this that can be more concerning for like a baby, in pregnancy too. So usually I'm working collaboratively with a physician in these situations. But you can still come to a hospital and have a normal, unmedicated, healthy pregnancy, and you can have one
Mhm.
that requires an emergency C-section. So there's a wide range. But a lot of people choose that because of, finances most times, I think, or they want to have pain medication because that's the biggest difference. It's like with out of hospital, most times you're not able to have like any kind of pain medication, like epidurals or something like that.
That brings me right into my next question and discussing like the various pain management options that are available
Hmm.
like during labor.
Yes.
And so like can you tell us like what those different pain management options are, and then why might someone choose one over the other?
Hmm. Um, I think what's important to realize is that you have a lot of options, right? You have a range. If you're somebody that wants to maybe have an unmedicated birth, but you need something to kind of help you get over some of the humps of the contractions, we always encourage like hydrotherapy, so water. So whether it's a shower, a labor tub, those can be really helpful. Aromatherapy, so using essential oils, massage, all of these things can be done at really any facility that has access to them. But I always try to start with the lesser of the more things that are not as mm, they're not like real interventions, I guess, if you will, but they're relaxation and coping mechanisms. So those are things I usually recommend. Squatting, different positions, moving around, walking, all of that really helps to facilitate your labor to progress in a natural way. And if those things kind of don't work for you, then we start to move into things like nitrous oxide, which is typically, as far as I know, you can only really get in the hospital setting. You might be able to get in the birth center. Probably just depends on what the midwife has access to, but it's laughing gas essentially, and it's been used for a very long time. And it doesn't have any negative impact on the baby. So a lot of people that helps if they still want to have a natural birth, but they want to have a little something to help them kind of relax and get over the hump of the contractions. Um, then we can move into things like IV pain medicine. So those are usually narcotics. So if you've ever taken like some kind of narcotic, it makes you very groggy or loopy feeling. So those become a little bit more involved because it does cross through the placenta barrier, and so baby gets affected a little bit by it too. They get sleepy, just like you do. Um,
Mm.
but this is usually more for like you're really, really uncomfortable and you need something stronger. So IV pain medicine, and then epidural would be the last resort. But with epidurals, they work for some people and they're really great for some people. But your movement is restricted because you're numb from the waist down now. So you're reclined to the bed. So there's
Mm.
pluses and minuses for all of them. I think it just depends on where you are in your labor process and what it is that you feel like you need, because it's all individually based. Somebody could start with nitrous and then feel like, no, I just need to go to epidural. So I mean, that's why I tell people to be open. You can have a birthing plan or a vision, but you want to be open to what the process might need because you don't know what it feels like until you know, and then you decide what you need in that moment. But there's a lot of things, we do a
Mhm.
lot of different position changes. We do like, there's something, a TENS unit. If you've ever seen like a chiropractor or a physical therapist, they use those little electrical pads that they put like on pain areas. And so it's really good for like low back pain and labor. So we use those too. But there's all kind of little tricks we have. I think especially midwives do a lot of tricks, help you get through.
Wow. So the father's there, babies. We were having the contractions, and getting ready to start pushing. Um, I know for me, it was kind of like so much all at once, and I'm kind of nervous for her, nervous for my kids to be born.
Hmm.
We're in a medical setting for us, and a father can sometimes kind of feel excluded from the process.
Yeah.
What advice might you have for the father to be active, present,
Hmm.
and helpful to the birthing process?
Like specifically like when it's time to push? Is that what you're talking about mostly?
Yeah, because I think that when it's time to push, that's when it's like the pressure's on.
Yes.
Your partner's probably in a lot of pain.
Hmm.
Uh, there's a lot of instructions going on. It was like push, push. We can see this is going on,
Hmm.
and a lot of terms were being thrown out that you know the first time around, I'm like, what does that mean? Like, oh, he's crowning, or
Right.
this is happening, and just foot down, or there's all this stuff going on. And I'm just like, just
Overwhelmed.
get my wife and my baby out of here
Right.
safe. Right. This is I'm overwhelmed
Yes.
and it's a lot for me. You're in a setting, and then all of a sudden, with my son, there was like, of course, the doctor that was in there, and then the nurse that was in there, and then all of a sudden there was like 8 nurses in there,
Hmm.
so to kind of handle like a small issue, he's fine, but
Yes.
um and it just, the room got filled. So,
Hmm.
and then you're like, oh, I don't hear him crying, or then they're weighing him, they're moving from here to there,
Right.
and then you get the skin to skin time. So I felt like everything was moving so fast.
Yes.
I like, they were asking me to cut the cord, and I'm like still kind of zoning out, like, what, like,
Yes.
what am I doing? Weird.
Hmm.
So how can a father be, prepared for that moment, be engaged, be present, not be in the way, but
Hmm.
be helpful
Hmm.
to both the folks helping to deliver, but also to his partner?
That's a great question. And I think that the first thing I always think about applies to, I think, everybody in the room, right? Especially in a hospital setting, because exactly what you described is typically what you see. It's a lot of chaos, it's a lot of people, especially if there's a more emergent situation. And so, as a midwife, I really try to honor and make space for like this natural pause that happens for birthing people that we often forget about because we're just focused on the making sure mom and baby are safe or a birthing person, or that they're safe. So um if you've ever watched somebody, especially like in a home birth setting, you'll see this more so because there's more of a calm that happens in your home. But naturally, when people have a baby, you push out a baby, there's like this exhale that happens. We don't really see it because we're just like the baby, this and that. But they just put, it's a lot of work to have a baby. And so they usually take a pause and they're breathing, trying to catch their breath. They close their eyes and so I think having respect for that pause allows everybody to kind of reset the tone in the room and the energy in the room. So I really try to do that when I'm in deliveries. So that's the first thing. Because I think it gives you also space as a dad to be like, enjoy what just happened, process what just happened, right? And then you're also thinking about, is the baby okay? And I also think the pause leaves room for explanation because I think sometimes in the hospital, especially, it's not, people don't always take the time to explain or tell you what's happening, especially in an emergency. Like sometimes I need to move quickly. I'm trying to tell you everything, but I'm also trying to just focus on getting this bleeding to stop or getting the baby to do this and that. But I think it's important, like you said, to really address as I'm doing things. Do I have your permission to do X, Y, and Z, or would you like to do this? Are you okay with that? And I typically think I can only speak from a midwife's perspective. Like I feel like most times midwifery care is about that. It's about respecting the space and honoring what feels okay for you guys. But I'm telling you why I'm doing this. It might be fast, but this is why I recommend it. And then I think that also leads into the encouraging the dad to ask questions. If you're hearing a word, what does that mean? It's okay to ask me. I might not think in the moment to explain it. You can ask me questions, like,
Mhm.
because if you don't ask, how will you know? And then moving forward for like if you have future babies, like you said, then it becomes okay, I've already been through this experience and I've asked questions, and now when I hear them, it's more natural to me to understand, why
Mhm.
steps are being taken. So I think that's probably the most important thing is asking questions. We all collectively really try to address things as they come and explain them to the family. But I always tell people, sometimes I see dads sitting way back here in the corner of the room on their phone, and I'm like, "What are you doing?" And it doesn't mean, sometimes it's teenagers, sometimes it's the older adult men. And I usually, when I see that, if their mom is by herself, like I just say, "Oh yeah, come on over," and I tell them to stand on wherever to stand. And sometimes they're nervous, they don't really know, they don't want to be in the way, like you said, but I usually always am like, no, we need you to come over here and support, hold hand, help them. So it's like helping them be whatever everybody else is doing, we just help them do that. But not big on counting when it's pushing, that's just me. But some people it works for, so I just let them do it. But with the epidural, it's a little different because you don't really feel things the same, so you kind of need that kind of guidance. But if you're like, unmedicated, your body knows exactly what to do, and it'll tell you what to do. So I just encourage those natural instincts to kick in. But you definitely are necessary to be there, and it's like right front and center. So I usually have you cut the cord, or sometimes there's one to catch the baby, with my support. Any of those things are fine with me. So I usually offer
Catching the
that.
baby might be a bit much, but cutting the cord was definitely great.
Okay, that's the first step.
That y'all, yeah, I was like,
It's a first step.
maybe, but it is. It's a man. I think, yeah, catching a baby. If you haven't seen that actual
Yeah.
process, you might be a little
I
nervous.
usually just take my hands and
But
I
I
put
will
them right here,
say,
and we're good. And I'm guide you. Hmm.
I couldn't even imagine, especially not my first one.
Yeah.
But what I will say, though, fathers, I encourage you to be there and participate in the process, specifically for the skin to skin time. I think they call it the golden hour,
Hmm.
right?
Hmm.
Where right after your baby is born, they put the baby right on your chest. I
Hmm.
think they first start with mom.
Yes.
And I believe, do they try to latch during that golden hour or do
Mm.
they wait later for the latch?
Yeah, the golden hour typically is time that is reserved for bonding, so it's like you said, skin to skin, and we try to help initiate breastfeeding if baby is interested. And typically within the first hour or two they are, they'll start to show interest. Some
Yeah.
babies right away. So, and skin to skin can be with anybody. We typically start with the birthing person first because, I mean, obviously they carry them, and we try to. It helps. The skin to skin actually helps to regulate baby's heart rate, their temperature, um, and just keeps the transition flowing, and babies, kind of transitioning into the world a little bit easier. So that's why it's really important too.
I think it's important for the simple fact that like the mother has carried this child and kind of been, building that relationship and kind of
Hmm.
making every adjustment to their daily lives with this person in mind. And so for the father, this is your first time being introduced to this person.
Hmm.
And so like you're getting to actually see them. So for me, it felt like it was such a huge relationship bonding experience from me to my daughter and my son, that I definitely wouldn't want to miss that. So I encourage people to do your best to be there for that process, if not just to cut the cord and so
Hmm.
for the golden hour and to support your partner.
Yeah.
I mean, all those things are important. It's just something great that I think we all should have the opportunity to participate in.
Hmm.
But you talked about this topic a little bit earlier, and I want to kind of go just a little bit deeper on it. Can you tell us what postpartum is and maybe discuss like how a father can support their partner during this time period?
Hmm.
Like, what does that look like? We hear
Yeah.
about postpartum depression, but postpartum itself, it might encompass a little bit more.
Hmm. So postpartum basically is the moment as soon as the baby is born. I think technically until 42 days, but it can be at least the first 6 weeks. That's what most people know it by, right?
Yeah.
Um, and postpartum is extremely important for a lot of different reasons. Obviously, a person needs to physically heal from having a baby, whether that's a vaginal birth or a C-section. C-sections obviously take a lot longer, are much more painful. And the healing process just takes longer because you've had an actual surgery on your uterus, right? Um, so that can look different for both those situations, but I think baseline, the needs are going to be the same. So, um, things that are important during postpartum are helping the mom to be get efficient with breastfeeding if that's what they decide to do, if they're exclusively breastfeeding. It takes time to figure out how to do that well, especially your first baby, because babies come out knowing how to breastfeed, but sometimes between the mom and the baby, like they got to work out the kinks, right? So sometimes you need help, and it could, if you don't have the
Right.
right latch, you can get pain, bleeding. It's uncomfortable. So we try to avoid those things by allowing you space to focus on just taking care of yourself, focusing on breastfeeding your baby, learning how to care for this new human being that you brought into the world. And that takes at least 6 weeks for the first time around. And so things that are important for, I guess, the village to help with would be making sure that mom is able to rest, to eat healthy. So I always tell people, minimize how many people you have come into your home. If they do, definitely hand washing should be essential for everybody before they hold your baby. But people can help do a ton of things. So some people do like do create like meal trains, but like family, friends can
Mm-hmm.
help create cook meals that can be frozen, in the freezer for the family. They can help with if there's other children, they can help take the other children, out for a day or however long to so they don't have to be managed by the new parents, and they still are being attended to.
Hmm.
Washing clothes, cleaning the house, like there's a ton of things that need to be done. And if those things are done, then it leaves mom less feeling responsible or guilty for like these things are not done. So you have people helping that piece, so they are still able to care for themselves and just focus on that. And that's really important, because if you have good support, research has found like having good support can decrease the risk of somebody getting postpartum depression, which is kind of the first step. Is postpartum depression can, in an emergency, can become postpartum psychosis, which is something more severe. That's some more emergent. You need help. From medical providers, because usually in these instances the mother usually feels like she wants to harm the baby or herself, and so in this case the father, whoever is with her, will want to get the baby away from her safely and get her to the emergency room, because that's really important. But postpartum depression is something that's can be common, especially if you have a history of depression. You have a higher risk of it. But again, having balance, having support can help a ton, because you don't feel as stressed or feel as much weight and responsibility for caring for your other children or making sure your family is still running afloat while you're trying to recover from having a baby. Does that answer your question?
Well, yeah, it does. I think, you want to, like you said, do your best to, but you also got to put yourself in that person's shoes and think about what are the things that could be stressors for that individual. Like
Mm-hmm.
you said, the house not being clean, feeling guilty about meals not being prepared,
Mm-hmm.
prioritizing the baby and your own rest and
Yeah.
your own emotions and stuff, and not being able to contribute to the rest of the family if there's other children or the other partner. There's a lot of things that could stack up
Mm-hmm.
around the house that can feel overwhelming, specifically if you already have a lot going on. So
Mm-hmm.
the more you can do to kind of be aware of what's going on, to support the person to prevent, like you said, postpartum psychosis or maybe even the depression part,
Mm-hmm.
is important. I think that also goes back to the communication and kind of having a plan,
Yes.
how you deal with stress, how you communicate with each other, making sure each other is checked in on and feel like they're okay,
Mm-hmm.
phone calls, texts, baby proof in the house. So there's just things that just don't come up and bring you from a level 0 to a level 10
Mm-hmm.
or 100 because, you know, now the baby's doing something, the mom's overwhelmed, can't deal with this. And so
Mm-hmm.
it's a lot to think about.
It is.
Having babies is a beautiful process.
It is.
Um,
It is,
I
but
have
it's
two
trying.
now, and it feels like is trying. Yes, it's so much that goes into this. But that's all of our questions for today. That was such an incredible interview. I thank you for all of this valuable information.
My
Brothers
pleasure.
out there who are listening to this podcast, we'll continue to provide you information on reproductive health as a variety of other topics that we talk about on this channel. So make sure to follow us on social media, like and subscribe to this channel, and tell your friends. So thanks again, everybody, and we'll see you soon. Thank you, Tia.
Thank you. Have a blessed day, everyone.